Medicare Advantage sneak peek for 2025. If you have a Medicare Advantage plan and or you are considering a Medicare Advantage plan, you may want to pay attention to this because there are some serious things that are taking place with Medicare Advantage for next year. Hi, I'm Chris Prang, the Medicare analyst. I'm a licensed agent in 14 states and I am based out of Charlottesville, Virginia. But as you can see, I am not there right now. I'm actually at the beach at Oak Island, North Carolina. Today, I just want to go through a short video explaining some of the changes and some of the things that you need to be aware of for 2025 when it comes to Medicare Advantage. Number one, the plans are adjusting to adapt to market realities. A lot of that market has to do with how much the government is willing to fund the Medicare Advantage plans, and the other part is utilization, how much people are utilizing the plans. So if the government is not funding it as much as the insurance companies had hoped for, and if people are using the plans more, what that means is typically increased premiums, increased deductibles, higher copayments, and less benefits. So what you're going to see on a lot of the Medicare Advantage plans is they're introducing medical deductibles on more plans, especially on PPOs, where if you go out of network. Some of the PPOs now, if you go out of network, you do have deductible, some you don't. What we're going to see is more plans will have increased deductibles on the medical side. Two, there will be less PPO plans that have what are called passive networks. So a passive network means you can go in or out of network at the exact same price, which is great. If you travel, you need a specialty hospital, and they're not in network, well, you can go to that specialty hospital at the same price you could for a network hospital. So we're going to see less passive PPOs coming up for 2025. The MOOP, the maximum out-of-pocket increases, are going up on a lot of plans, and some of them very, very high. Some are going to jump up $3,000 and $4,000. So your MOOP is the most that you can pay in a calendar year out of pocket for co-payments, deductibles, and co-insurance. So obviously the more you pay, potentially the less the insurance company pays. Now the good thing is very few people on average spend more than $2,000 or $3,000 on their Medicare Advantage plan. But if you have a serious health issue, you could be on the hook for not just 3 or 4, but 5, 6, 7, 8, 9,000. If you go out of network, it could be even higher than that. So what you want to do is you want to pay attention for your annual notice of change, which may have already arrived or will be arriving very shortly, and that will tell you what the benefits were for 2024 compared to 2025. You'll see the premium for 2024 versus 25, deductibles for 2024 versus 2025, the maximum out of pocket for 2024 and for 2025. Next, we're going to notice that a lot of the optional supplemental benefits will not be optional anymore. So some of the plans would allow you for an extra fee to add on optional supplemental benefits like dental and vision. So more of those are going by the wayside because so many of the plans now just have those features incorporated into them. A reduction in the extra benefits. So the dental, the vision, the hearing, the wonderful grocery cards, the transportation, the over-the-counter benefits. What we're going to see in a lot of plans is those going away or coming down. So maybe last year you had $2,000 worth of dental. Well, this year you may only have $1,500 or $1,000. So you want to pay attention for that. Next, very importantly, our plans are exiting. So a number of the companies are terminating plans. And instead of getting an annual notice of change, what you're going to receive is a termination letter, and you are going to want to hold on to that, because if you don't want a new Medicare Advantage plan for 2025 and you want a Medicare supplement and you couldn't get one before because you didn't qualify, well, now you will be able to, because in that letter it will tell you that you have a guaranteed right to get a Medicare supplement. So please pay attention for that letter. So let me mention some of these companies that are terminating and exiting states. Centene or WellCare is leaving 6 states totally. Cigna is dropping out of 8 states and various parts of those states. CVS Aetna is leaving in at least 5 states and various markets within the states. So when I say states, I don't mean the entire state except for Centene. And then Humana is exiting plans in 23 states. They're not leaving the entire state, they're just dropping plans. So they will have other plans available in those states, but you want to pay attention to those. So that is a real quick sneak peek of what's coming up for 2025. If you have a Medicare Advantage plan and you want to review it, or especially if it's terminating and you live in one of the states that I'm licensed in and you want my help, then by all means, please reach out to me either by phone or through one of my contact forms on my website. I'm Chris Prang, the Medicare analyst. Make it a great day.